My name is Dr. Zoe Diana Draelos, and I'm a clinical and research dermatologist. I've been working in the area of research dermatology for approximately 30 years, and I study everything as it relates to the hair, skin, and nails. This is a very interesting area because dermatology encompasses so many areas, but most importantly, it encompasses the area of making everyone look and feel the very best they possibly can about their skin. Now today we're going to focus on a very special area of the skin known as the neck. Neck is very interesting skin because it's a transition between the face and the body. The skin on the face is the thinnest on the entire body, whereas the skin on the chest and the upper back is some of the thickest skin on the body. So what does this mean? This means the neck is in between. It's often said that you can tell the age of a woman by looking at her neck. Because on the face, people use a lot of sunscreen, undergo cosmetic procedures, but many people forget to put sunscreen on the neck. And that means that that is sun unprotected skin. And most procedures such as laser resurfacing, peels, etc. cannot be done on the neck because the neck is always in motion and heals very poorly. So the neck gets poor sunscreen coverage, and as a result of that, you can get discoloration, brown discoloration on the neck, which is from abnormal melanin or pigmentation of the neck. You can get reddish discoloration of the neck, which comes from blood vessels, broken blood vessels, that become more prominent over time. And finally, you get a sallowness or a yellowish discoloration of the neck, which is due to thinning of the skin and the increased visibility of the oil glands known as sebaceous glands. That combination of yellow, red, and brown leads to a condition in dermatology we call poikiloderma, which is more commonly known as people with a red neck. Preventing that red neck is important because you want to look the best that you can look. Therefore, addressing cosmetic issues as they relate to the neck is of vital importance. First, wear sunscreen. Second, the neck needs to be treated very gently. The second most common place for allergic contact dermatitis or allergy to products has to be the neck after the face. Because the thinness of the skin determines how much a product will penetrate, neck products need to be designed for sensitive skin and need to be applied very, very carefully. Neck products also are applied to an area where there's a lot of sweating. Most people sweat on their neck. The neck also gets rubbed by clothing, collars, ties, high neck garb that people wear. All of those can rub the neck as well. And finally, the neck is also an interesting area, especially in the back, because it's a juncture between the scalp and the shoulders. So that means that sweat collects in that area. People can get a lot of areas of itching back there. There are a lot of skin diseases that uniquely affect the neck. So applying products to that area is very important, but those products need to be specially designed. The neck is transition skin, and it also shows your age because you lose the fat, the subcutaneous fat under the skin on the neck. So that means the muscle bands, it's called the platysmal muscle, becomes more prominent. So if we're going to summarize the changes that occur with aging over the neck, we would say 1, it doesn't get sun protected, it ages more quickly. 2, it's thinner skin, so it's quite sensitive. 3, fat loss on the neck disturbs the normal contour of the neck and you start to see muscle bands. And finally, discoloration of the neck, either poikiloderma or red neck syndrome, are very, very common. The neck is a unique area. It expresses its aging just like the face and every other area of the body, but it does it in a very unique way and deserves special attention.